because we have had so much interest in TEFCA's new individual access services exchange purpose and the new technical requirements and the business requirements related to that new TEFCA patient access use case, I wanted to bring on a specialist, and that is Peter with ID.me. So I am going to give you just a couple bits of news and then hand it over to Peter because he has a lot of great content. In the meantime, feel free to introduce yourselves in the chat. We'd love to all get to know who you are and who you're with, and maybe what brought you here today. With that, let me just quickly make a couple of news notes. Probably the biggest news is the Care Quality Advisory Council did release an updated policy document around a use case for care quality that formerly was known as on the behalf of initiating queries, and now through their alignment with TEFCA strategy that we're embarking on this year, this is the first change in the network that's happening in order to better, more closely align with TEFCA standard operating processes, or SOPs, as TEFCA calls it. And so now, on the behalf of is called delegation of authority. And whoever came up with that name was a little crazy or had a big sense of humor. I don't know which it is, but the short cut for that, of course, is DOA. So we find that amusing. So I'll be referring to it as DOA. So we are in the middle of an implementation window. What is kicked off right now is that the business process is now formally in place. And that simply means that the provider group that is implementing a new health tech vendor's technology that is also using another EMR, and their data is available for query through their EMR system. That's called a DOA situation, or formerly OBO. There's some new business processes. And then we are making some technical changes in the community. All of that work is being done in this implementation window. So the business process starts now from the health provider approval process and notification process. And then the technical work is being done. And then we have mid-September as our final, everything's in production, both the business side and the technical side. So that's a lot. So I'm going to have a special session to cover the details of that. I have taken enough of Peter's time, but I did want to mention that in addition to my normal office hours in June, I don't want to wait that long. We're going to get a special session scheduled either next week or the week after to talk about the new delegation of authority. Okay, with that, Peter, I am going to hand it over to you. We can't wait to learn more about IAL2 and AAL2.
Brilliant. Thank you so much for the intro, Marilee. I'm Peter Eivaz. I'm with ID.me. I'm our senior solutions consultant for healthcare. Just to give you some background on where I've been in the industry, I started out implementing Epic. I've moved over to patient experience companies, both on a professional services as well as a sales capacity. Worked at DocuSign, leading their healthcare solutions consulting. And then I moved over to ID.me. So that is just to give you a little bit of the perspective on the industry that I've gained. And a lot of this is going to be, again, me providing a little bit of an outside in perspective, because I think IAL2, AAL2 is something that is relatively new to the industry. I think to Marilee's point, right, we're seeing these requirements coming up through TEFCA. But what I would like to best understand through this conversation is, how do we make this process something that isn't just another cost on your balance sheet, right? What all are you going to gain by implementing identity proofing at an IAL2, AAL2 level? So please interrupt me along the way if you have any questions. And then we may or may not have some polls depending on some tech difficulties or not, if we've resolved them. But please throw questions in the chat here. I might just defer some of those poll questions to the chat anyways. All right. So yeah, we'll start with a conversation about, what brings everybody here today. Make sure that I'm catering the conversation a little bit more to the topics of interest for all the attendees. And then I want to, again, I'm providing my perspective on what I'm seeing with patient identity. And please augment that. Let us know what's interesting on your end. Um, I'll share what we think are going to be some of those great operational and clinical benefits for IAL2, AAL2 proofing. I can show you what ID.me is going to perform in that capacity, and then let's just leave it open for some Q&A. All right. So I think that a lot of these points are going to be pretty familiar with all the folks here, but over the last decade or so, we really see this push into digital patient access. And my thought here and my thesis statement is that while we're trying to deliver equitable access to everybody online, what we're also trying to do is understand who that patient is, because if we don't have a firm understanding on a very basic identity level of who that individual is, then it's hard to determine what their history with your organization has been, what their needs are, right? So proofing your patient is going to give you that fundamental understanding of who that patient is, so you can build off of that, develop their clinical profile, and then also try and facilitate better access to your resources, what their preferred modes of communication are, and the like. So I really think that knowing your patient is critical and able in an effort to serve them in a more efficient manner. Uh, so this is where I think in the last couple years, generative AI has actually become very interesting, because I think we all have used ChatGPT to help write some of our emails a little bit better, or maybe get some PowerPoint presentations done a little bit more efficiently, not calling myself out. But what it's also done is it's introduced very interesting threat actors through generative AI. So what I want to show you a little bit later on is how we see generative AI manifesting through a threat cell, and how these folks are coming from overseas and are incredibly sophisticated. They're sharing this information with each other. They're profiting off of the sharing of this information. And we want to make sure that you all are able to focus on the things that matter most, which is delivering effective patient care. So we want to make sure that we shore up your perimeter there. And then the last component, which I think might have been the primary component for a lot of people joining here, are the regulatory drivers, right? So we have TEFCA IAS requests, which are mandating IAL2. But again, I want to see what is going to be an additive service. So you're adding on IAL2, but what else can you gain from improving your identity proofing? Um, Jessica, the real Jessica, not the other 21s. Have we figured out a polling capability? And if not, no worries. I can.
No, we have not, sadly, but we can do it in the chat.
Yes. Okay. So in the chat, what I would love to better understand is, um, I just threw out four. I'm going to throw out 4 bullet points in the chat. Um, which one of these points are resonating with you? Do you feel like you came here just for IAS requests? Do you think that security is going to be one of the bigger issues that you all are tackling, or is this a digital patient access? And I'm going to check back in at the end of the chat and see if before and after our conversation, whether that perspective has changed at all, or whether it's consistent, and we need to adjust some of our perspectives externally. So go ahead. Would love to see what everybody's opinion is on that in the chat, or I'll just give folks a moment to hop off of mute and see if anybody's brave enough to speak up. Right. Thanks, Martin. Appreciate that. So Martin saying digital patient access for health information exchanges statewide. All right. Yeah, patient matching and more effective SSO. Oh, got a thumbs up there. Yeah, I think being able to speak to eliminating duplicate records is something that we'll be taking a look at. And actually, does this lead directly into that? I think it does. Um, yeah, because patient matching, we're really starting to look at this last bullet point of deterministic versus probabilistic matching. But I'll start at the top here. Please keep the opinions coming in through the chat. But again, outside in perspective, what can IAL2 proofing and AAL2 authentication provide you? So duplicate records, right? This is coming both from a patient experience and employee experience angle. If I am an employee and I have spent years trying to get a degree in delivering effective patient care, but on a day-to-day, I'm spending a whole host of time performing administrative and clerical tasks, right? That does not align with my expectations of what I want to serve the community with and my organization with. So um, I, I don't think they would mind, but I spoke with Oshner in the past for different engagements, and I think one of the great things that they externally state is that they want their providers to work to their degree. So they want their nurses to be delivering care. They don't want them to be manually keying in information about patients from intake forms, right? So, how do we use IAL2 and identity proofing for clearing up those administrative tasks? We can get into that a little bit later. And then also, I think that this is going to start bleeding into both patient and employee experiences. There are certain tasks that are highly sensitive. Therefore, historically, they've required that somebody manually reviews it. So, for example, if I'm a patient and I want to retrieve my medical records, I know for a fact I have implemented this solution elsewhere where I have the patient plug in their information, their demographics. I have them take a photo of their driver's license and put it on an attachment. And then that's routed to somebody in your system that is going to manually review that information. Couple issues there. One, patient experience. Not my favorite to key in all that information, especially if you're supposed to already know who I am as a patient. It's just another added barrier. Two, I have to take out my wallet. I have to take out my driver's license, upload that information. That's cumbersome. That leads to abandonment rates. From an administrative perspective, I now have to send this up into a queue for somebody to manually manage. And then from a security perspective, I think we have to ask ourselves, how are we certain that that document wasn't manipulated in any way, especially with generative AI at this point? And so, are you all going to be maintaining your tech stack to ensure that the uh, that your ability to test generative AI is the most up to date and that there aren't any holes in that system, or are you going to need to use an external vendor for that? So I won't get too far into that, but an example of these high value or sensitive tasks that we historically have not been able to automate because of the highly sensitive information that is being delivered. I think that another point here is that if we're looking at other verification methods, so I see knowledge-based verification all the time when patients are trying to access portals. And the problem is that historically, this might have been a better way of shoring up a patient's identity by saying, I'm the rightful owner of this identity because only I am the one who should know this information. But the problem is that at this point in time, your social security number is either free or a couple dollars on the dark web. And so this is no longer private information, it's public information, and threat actors have access to it. So if we want to be very sure that we are delivering access to only the appropriate individual, then we need to make sure that our identity proofing methods are a bit more advanced and aren't just the presentation of information in order to gain access. And this is where we get into deterministic versus probabilistic matching. So probabilistic meaning in that knowledge-based verification question, I'm effectively saying that there is a probability that this individual owns this identity based off of the fact that they are able to correctly identify their street address or the make model of their car. Um, in other ways, we've seen probabilistic matching through software like EMPIs, right? You have an algorithm that is determining whether or not you can consolidate records because, okay, I have an address that's shared, I have a phone number that's shared. So a little bit different from the previous example. The issue that I see with that kind of probabilistic match is that you have something in the back end that's pushing through that consolidation without having the actual owner of that information rightfully claiming that session or that action, right? Um, so deterministic matching is where we start getting into a combination of both presenting the appropriate information and then also in real time saying, I am the actual owner of this information. And that's going to be conducted through things like biometrics, device possession. So it's taking some of the different angles of probabilistic, adding a couple layers of additional technology, and then shoring up the identity of this individual. I'll pause here for a moment if anybody wants any clarification on that or sees any other maybe probabilistic modes of matching identity in your system that you're curious about. But if not, feel free to stop me along the way. So I'm going to try and click through this slide a little bit, but here's a direct quote from our NIST 863.3 publication, which starts to look into IAL2, AAL2. And so historically, and it really depends on the industry, it might not matter who you are on the internet. Um, at IDMe, you might hear some pitches from us. We say you could be Daffy Duck. And honestly, if you're purchasing an Under Armour shirt, we don't really care that much, right? It's not nearly as sensitive as an individual who says, "Oh, I want to access my healthcare information," or I'm accessing on behalf of somebody else. And so through these probabilistic methods, if we, let's look at the bottom right-hand corner of that image, we have a fuzzy understanding of who this person is. And through IAL2 proofing, we gain a fuller picture of who they are, so that we can be more certain in automating certain actions, right? If I go through with IAL2 proofing, we've established a deterministic method that required strong evidence against authoritative databases, so that's incredibly important. And now I feel more comfortable in digitally transacting with this individual because I'm more certain of their identity. So, identity proofing, incredibly important, but the nature of digital transactions is that they are going to be recurring, especially in a patient setting, right? There might be more transactional cases with, birth certificates, death certificates. You might not have an individual with a sign-in or an account, but for all of these other situations where you have a returning user, it's important that we didn't only proof them, but that we ensure that they are still in possession of that digital identity credential. And that's where AAL2 comes into play. So what I would challenge everybody on this phone to do is look at what your authenticators are today. Because if they're email, that is not AAL2 compliant. And the reason that AAL2 compliance is so important is because if folks can start coming in and compromising credentials and starting to bypass that identity proofing methodology, then the whole system crumbles. So repeated authentication becomes just as important, if not more important, than that previous identity proofing session. We need to continuously be observing device fingerprinting, device activity, and then we also need to ensure that that individual is still in possession of that device. So AL2 compliant modes of authentication look more like, on the weaker side, SMS and phone call codes. On the stronger side, code generators, 6-digit codes from those apps, security keys, passkeys. everybody, if you can implement passkeys, do a passkey. It's effectively a two-factor authentication method in one because you're using both biometrics and device possession. So that is another really important dialogue that I want to make sure we don't separate the two of those. Marilee, did you go off? Yeah, go ahead.
I did, yes. Yeah, it's funny because you and I were talking back and forth and you threw in AAL2 and I was like, well, I don't even know what that is. And it's funny because now that you defined it, of course I know what it is. But I do think you're making a very important point that if you can do IAL2 really, really, really well, but that doesn't matter if the AAL2 part isn't, included or thought or being built into the overall solution, right? For all of you, I think most of you here are either managing, a third party software application, or you are a vendor that is selling a software application. And I know many of you are high trust certified and you've been through, or SOC 2, and you've been through a lot of this identity, authentication type controls. But I just think it's interesting. I just think it's really useful to understand that these two concepts are very, very closely aligned. I think in particular with the IAS, a patient asking for their data use case, but certainly all use cases.
Thank you so much, Marilee. Yeah, and Lisa, that's a great point, right? You're putting a lock on the door, but then are you actually locking it? Are you having the individual use their key in order to unlock? That's I'll probably steal that analogy, honestly. So thank you for that. All right, yeah, keep it coming in chat. Also, the commentary on patient matching using gender as a match. I think some other things, just so you all have a bit of context on the conversations that we have. Folks will ask a lot about matching on certain self-attested attributes or demographic information as well, and that's something that I would have you all think about, right? Like address, for example. I live in Brooklyn. I've moved at this point 3 times in the last 3 years. And so my driver's license, maybe shame on me, is not updated with my most recent address, right? So that ends up reflecting in the authoritative databases, but that no longer is a great matching criteria, right? So we want to look at things that are unique to an individual. Date of birth, you know, unique, but introduces duplicity in certain instances. Social security number, sensitive, truthfully the best identifier. And what IAL2 credentials are actually going to provide you is effectively a de-identified social security number. Because what we do at ID.me is pass you, for the technical folks on the call, it's a GUID. For the non-technical folks, think of an alphanumeric sequence that is unique to the individual across the entire web. So my Peter Eivaz identifier at the IRS, which is, we guard the IRS, guard the SSA, that's the exact same identifier used across every single instance, whether I'm filing my taxes, whether I'm getting benefits from the state, or whether I am getting a discount at Under Armour. So that ends up being a phenomenal way of matching and identifying without presenting personal information. All right. Okay, so this next slide, I'm going to show a clip that actually we recently played on 60 Minutes last week. So there was a clip on identity fraud and how this is manifesting. And I won't do too much to actually repeat these points, but this is a real interaction done through our trusted referees. So I'll get into that a little bit later. It's effectively our fallback if somebody doesn't go through self-service effectively. And these are now old tactics that are being used from generative AI. It is so hot and constantly evolving. So if you think it's scary now, it gets a little bit crazier as the time goes on. But Um, oops, sorry, just accidentally locked my screen. Um, Pay special attention to this individual's face, like the perimeter of their face. I think that'll help everybody identify.
Confirm your name.
Hello,
Hi, can you confirm your name?
Peter Benson.
All right. So again, look at the perimeter of this individual's face as they present their identity. So we can see the deep fake mask starts to break, right? I'll pause it, right? The individual's facial structure just drastically changes, right? And this is a technique that our trusted referees are familiar with. That's why, as part of this process, they will have an individual put their ID directly in front of their face because we know that these masks are not sophisticated enough at all times to break when there's a disruption. That being said, it is getting significantly better. If we go a year back from this point, the deepfake masks were pretty comical, but now they are getting incredibly convincing, right? So this is the threat that we are seeing on our end, not just at the IRS, but I think at your organizations or the customers that you serve when folks are trying to gain access to digital accounts. Marilee, I saw you go off mute if you want to add some points there.
Oh, no, sorry, you're good.
Oh, no worries, no worries. All right. So let's get into what ID.me does within this process. So you might have seen us at different points. We act primarily as a credential service provider and as a login tool. And then, downstream, we also perform specific transactions within an individual workflow. But here's the problem that we saw in the market was that there is this desire for portable credentials like a login with Facebook or a login with Google, but from a security perspective, I don't think any of us are looking at that credential and saying that it's the most trustworthy. And then also, I think that there is some context around Facebook and Google using information for marketing purposes, right? So it comes at an inherent disconnect with security and privacy. On the other end of the spectrum, we have credentials that are considered a bit more trustworthy. However, they're not portable. That means that folks are generating tickets for your organization to reset passwords. Maybe they lost 2FA devices. And so this is not only adding friction and a cumbersome process to the folks that you're serving, but it's also adding that added operational burden to your staff because they have to deal with the tickets for account access. And so what we're doing here is that we're merging the portability of a credential like login with Facebook and Google with the security of that IAL2 certification. So I am going to get off this slide immediately. This is just to say that we're already out there. This is not a hypothetical service. We serve over 148 million Americans and some international users as well. And then 75 million of those credentials are at that NIST IAL2 policy. So that's more of what this is for. I just want to let you know, this is a well-established process. We guard the IRS, we guard the Social Security Administration. So and we've been acting in that capacity for multiple years. And so what we're going to do as part of our identity proofing services and our authentication services is we provide 3 pathways for users. So they can go through self-service capabilities. I'll show you what that self-service proofing looks like. And by NIST standards, the IAL2 vendors on the market really use a similar structure. I'm not going to try and compete. I think that there's a lot of operating at the margins there, but you provide a strong piece of evidence, which is effectively a government issued photo ID, and then you supplement that with 2 fair pieces of evidence. Generally, that is going to be a device possession check through a telecom provider, because then, to an earlier point I made, we're taking that information and then we're linking it back up to authoritative records. And then the last component of that fair evidence check is a financial records check through like an Experian, a TransUnion, and the like. So that's the self-service component. What I'll say is the self-service capabilities end up disproportionately affecting certain populations of folks. And those populations of folks that are underrepresented in credit bureaus are the ones that are generally going to be hurt the most. So if they fail at any point in the process, um, what you might face, depending on the IAL2 vendor that you go with, is that your organization has to deal with that gap in identity proofing, right? You either get an inconclusive result or potential fraud, whatever it may be. And then we're back to square one, where your organization is responsible for conducting identity proofing. You have staff that is trained for an entirely different capacity that is now responsible for something as sensitive as that. And so what we wanted to do is provide you with that relief valve. So as a first fallback, let's say, for example, there was a scratch in my barcode, a smudge in the photo, and our self-service tools just weren't able to act effectively. We have a human in the loop reviewer. So these are folks in contact centers in the US acting 24/7 that are going to just operate in the background for 30 to 60 seconds, with little wheels spinning, and they will try and resolve that incident. If that individual in our call center is unable to go ahead and resolve that identity, this is where we get into our virtual in-person proofing. Think of it as a Zoom video chat. And this is not only a fallback option, but it also, for certain populations, like tribal nations members, where they might not have documents like a driver's license, a passport, a pass card, a state ID, and instead they're looking to use their tribal nation's ID. This gives us that additional flexibility to rightfully deliver a digital identity. And that's where you can see, throughout these three methods, ultimately, our mission is to deliver digital identity to anybody with a legitimate claim to that identity. So at this point, I can move into a demo, but I'm going to pause. Does anybody have any questions on what we've presented so far?
Can we
Yes.
go back to where you were, Peter? And I definitely going to keep this short, but I think we're now getting into some of the, if I look at the comments in the chat, I think, and Carrie touches on one of them, those folks that would be difficult to do the self-service, even maybe with a human reviewer in the loop, and fall back to the virtual in-person proofing. Do you feel like that's a viable solution for someone with a family member in a nursing home that maybe is helping them do that process, and getting on a virtual call? What about when you have a power of attorney or legal guardian in the loop? I know in our family situation, my brother's power of attorney for my mom, could definitely benefit from, or her family could benefit to enable her healthcare services delivery. I know the world that our friends at My Directives operate in, which share advanced directives, are often in that world where you're dealing with older people. So if you could just, and I know you're not going to have all those answers, but maybe just comment on what y'all's experience has been so far, and not just dealing with the folks that maybe financially aren't really present in the system or operate with different identifiers, but people who need that further assistance and are being cared for by family members or other legal guardians.
Yeah, absolutely. Great question. So just I would look back at our customer base, because we're delivering our services to state and federal agencies. We're doing it for state benefits. We're also doing it for Medicare and Medicaid populations. So I would say that actually this lines up really well with what you're talking about, Marilee. We want to make sure that we're an accessible service to anybody young and old, folks that are underrepresented or perfectly represented within credit bureaus. And that is one of the areas where we ultimately get ourselves to about a 92% pass rate for initial verifications across the board. And then ultimately, once an individual has proofed once, the idea here is that they never have to proof again. So I'm not going to pretend that we add zero friction to a process. We're not ignorant about that. However, we want to make sure that we respect the fact that that individual did go through that process. So subsequent times that they're interacting with their service, they never have to proof again. If they're up to the appropriate standard, they will just have to authenticate. So I think it's a little bit of a combination of us being an accessible platform, either making sure that deaf and blind individuals can go through it, folks who are trying to guide parents through it and the like, or individuals who cannot procure the documentation that's necessary for self-service.
Thanks. Let's see the demo.
Yeah. All right. Can everybody see my screen? All right. Perfect. All right. Just so you all know, this is I got permission from my brother to use their website, so don't go ratting me out. But I've overlaid Acme Health over here. So how is this going to work within a healthcare provider? Like I mentioned, for ID Me, table stakes for us is to be at the front door as a sign-in. You can use us transactionally, downstream. But what we find is that when we separate the login process from a point in time identification, then that's actually going to generate more pain, both for the patient in this case and for the administrators. So more help desk tickets are generated, and there's generally a slower time to actually resolving that transaction. So if we go ahead and we perform identity verification at the top of the funnel, we can always step it up downstream. Maybe we start with a lower piece of evidence up front and then ask for a little bit more later, but at least establishing a preliminary connection gets the ball rolling and improves our access rates. I'm going to go ahead with the individual who already has an ID Me account at a low level. So much like a sign in with Google, a sign in with Facebook, this individual is just going to be responsible for presenting their first factor of authentication and a second factor of authentication, depending on the policy. So like I mentioned, actually, I'll go back, right? We see 6 different AAL2 compliant options. This ends up differing for certain things like FIPS 142 compliance for EPCS. We won't go down that rabbit hole. But the weakest example here is going to be text message and phone call. Everything after that is significantly more secure. So again, if any of this information has scared you a little bit with the deep fakes, I would go ahead and look at what your authentication methods are and what your account recovery methods are. If I say I'm locked out of my account, are we delivering access to that account by asking the individual what their birthday was, what the last 4 of their social was? Because that is introducing a vector for fraud. So after I first and second factor authenticate, this last step is if the individual has an ID Me account elsewhere, but they have yet to interface with your organization. And we are a user consent driven platform. So in order for this individual to go ahead with this process, they need to explicitly agree to the information that they're sharing with you. This information is going to be contingent on the policy. It's highly configurable to what you all would like. And then they also implicitly agree to the organization's terms of services and privacy policy. And importantly, they can revoke this access at any point. So we get into conversations about, oh, our organization doesn't want to own this data. Our response is generally, A, they explicitly consent to sharing that information with you. And then you are not obligated by any means, unless there are certain compliance or regulatory measures, to ingest this information and store it. So just a commentary on this consent process here. But you can see that once we go through that sign-in process, right, I'm welcomed into the website. And what I want to illustrate here is what I think my pie in the sky version of IAL2 is. So let's say that originally we had a need for the user to sign in order to chat, right? I interact with this chat window. I now have a full understanding of who my patient is and maybe whether they have an existing appointment that's coming up, right? We have this patient profile that's a bit more fleshed out, and I have this upcoming appointment with Dr. Barr. What I want to tease out is a capability and a partnership that we have been taking a look at, which is now that I have a proven identity, I might be able to deliver insurance information. So not only are we eliminating help desk tickets that are being generated through login events or MFA recovery, but we're also going to try and help you capture patient revenue. So certain companies like Nirvana, for example, are able to deliver a 90% match to carrier and member ID with something like first name, last name, and zip code from an authoritative database. So there's a lot of cool applications that are coming out from connecting with a verified credential, like an IAL2 credential. The other component that I'll take a look at is, let's say that I might want to do a sensitive action like a records release, right? Hypothetically, for the sake of this demo, let's say this individual has not IAL2 proofed at the IRS or anybody else that requires that. This is where we get into the potential to step up their security, right? And so transactionally, they can now interact with ID.me, and we never make folks go through the same process twice. If initially we had them go through and verify their phone number or upload a driver's license, we won't make them do it again, but I just want to show you the full workflow from start to finish. So like I mentioned, in order to go through self-service, there are going to be 3 pieces of evidence we need. 1, strong piece of evidence. 2, fair pieces of evidence. So we can do that by capturing driver's license, state ID, passport, or pass card. And so once we upload that, a couple things are happening here. We perform a data integrity check and a document integrity check. So we're looking and performing optical character recognition at the front of this license and gathering that information. But we are also going to compare that to the information that's encoded into the PDF 417 on the back of the license. Great, we're making sure that's congruent. And then we're also performing a document integrity check. So we're going to look at the materials of the document. Is it consistent with what we expect for a South Carolina driver's license? We look at the spacing in between the characters. We pay particular attention to the cutout of the face to see if there was any kind of manipulation that might indicate the use of generative AI, holographics. And so anyways, these are the different capabilities that are used to try and prevent generative AI attacks. And also, these vendors phase in and out. So somebody like an ID.me is really an orchestration platform where we're constantly assessing what the best in breed vendor is. Okay, Lisa, you're asking if the license needs to be a picture or a PDF. Let's see if I have that screen right. It's you can either take a live photo, and then the other way of doing this is you can upload a file or a photo. We look for a JPEG, and it's under 16 megabytes. And so if a user ends up uploading something that isn't consistent with the formatting that we need, we'll deliver that message, or they won't have the opportunity to choose a picture with the incorrect format. And so going back to deterministic versus probabilistic, right? This is just me delivering information to a certain degree, right? So we're still in that probabilistic territory. Now, how do we make this more deterministic? The deterministic method is through biometrics. And so what we do through our vendor is we take them through a liveness check where we present a unique array of 10 different colors on the screen, whether it's a mobile device, whether it's a desktop. And that unique array of lights flashes off the individual's face and is captured by the front-facing camera. Couple things to comment on there. the 10 different colors are because each color is going to deliver a different expected skin transparency. So magenta reflected off of your forehead is going to deliver a different transparency than magenta off of your eyebrows, or cyan off of your nose and other oil producing areas. So it's really just a method for us to try and eliminate presentation attacks. So like picture of a picture or a mask. And then also the 10 different colors is important because we're starting to see replay attacks where bad actors are feeding a live they're feeding their camera stream through software, and then they're trying to present that as the actual live representation. And so by having these 10 different colors that are being generated, I'm forgetting, but I think like 10 factorial is effectively a little bit more over 3 million different combinations. So in order for that replay attack to succeed, they need to correctly predict the sequence of those 10 different colors. So all of this to say, we're trying to eliminate the generative AI. We're trying to eliminate the presentation attacks. And then we're taking this liveness image and we're comparing it to the previous step of that identity document. So now we're a bit more comfortable to say, okay, this individual is the rightful owner of that information. So that's our strong piece of evidence captured. The next piece here is the telecom verification. So we send a text message out to this device. It cannot be a voice over IP. And then we're also performing device analytics. We're checking for SIM swaps. We're looking at the device's geolocation. We're seeing if the IP address is bouncing and it's producing an impossible traveler situation. We're looking at account tenure and history. All of these are trying to determine whether or not an individual has stood up a phone number in an attempt to establish this identity, you know, in an unjust manner. So another way of both, getting that information might be a little bit more probabilistic, but the ownership of that device lends itself to a little bit more of a deterministic method as well. Marilee, do you have any thoughts?
Just a 10-minute warning.
Perfect. All right, wrapping up soon. Last piece here. Financial records check performed through Social Security. Again, this is our highest level policy. This is not a requirement. And if an individual does not have a Social Security number, then we have those fallback options through that video chat as well. And so all of this is to say we performed our identity proofing. We're presenting this final step for an individual to determine whether the information is correct. And if they have not consented to sharing this information, then they will need to explicitly consent. So that's the full IAL2 demonstration from front to back, and that is what folks like the IRS and the SSA use to deterministically deliver a digital identity. So I'll actually jump off of the demo screen here. And just a quick recap. It sounded like consolidating and delivering effective patient identity is absolutely a top priority for you all. Again, we have this outside in perspective. I don't know how much pain your organizations are seeing from these duplicate records, but I think we can certainly imagine that the duplicate records leads to an inability to deliver effective care. And it also creates an administrative overhead for you all, where you have to manually go ahead and perform this deduplication. So if we remove some of those probabilistic methods and we augment a database like an EMPI with an IAL2 credential, then we can use this now fully verified identity to help deduplicate records and then feed downstream systems with robust, clean, authoritative data. We can also start to deliver access to highly sensitive information, like in the example of a medical records release, through a self-service channel. We don't have to burden the patient and we don't have to burden your staff with going ahead and performing that manual check. And we do that through that IAL2 proofing. And then lastly, we understand that there is a burden that we're putting on our patients to a certain degree by presenting them with identity proofing. So what we want to do is respect that. Again, provide them multiple avenues, provide them backups, consistently be understanding what the accessibility limitations are. And then once they do it once, we provision that credential across the web. We don't want them to do it again. So that taking that event, turning it into a portable credential, and then ultimately leading to better adoption and satisfaction. So I'll get off my soapbox. And if you all end up having any questions, please feel free to reach out to me. Lisa, I see your question. So let's see. How far away are we from many consumer apps being able to utilize identity providers like ID.me to handle the login rather than doing it themselves? So, fantastic question. That's what we end up doing for a lot of commercial entities as well as state and federal entities. We actually at this point will not deliver IAL2 proofing without also being a login. Our philosophy for that is, again, it leads back to better adoption rates. And the way that our model works is that it's a user per year, unlimited licensing. We want you to put it in as many places as possible. So you might as well put it upfront, resolve the identity, and then look at individual transactions downstream. Mike, you're asking if any EMPI vendors are already adopting ID.me. We have had conversations with different EMPI vendors, so very astute. I would love to, if we have any EMPI vendors on the call, let's chat. I think that this is really a complementary solution because you all do an exceptional job of taking boatloads of data and then trying to consolidate them. In my head, what I think is the path forward is we can flag those records as a way of saying, okay, this might be a riskier record. We're not entirely certain that this is unique. And then that way, you all can present those patients with an opportunity to IAL proof, IAL2 proof. And that way you then put like a golden record stamp on that EMPI record to say, okay, we have officially conducted IAL2 proofing. This is going to be our golden record moving forward. So whether that ends up being a direct integration or just augmenting an existing integration, I think that's a great call.
Yeah, and we have several HIE folks with us, which Mike is with Reliance eHealth Collaborative, our customer, and then we have Carrie with the My Health Access in Oklahoma. And I know she mentioned consent, and I think one of the problems that the HIEs are trying to solve, that where they're starting, I think, to get more thinking about direct interaction with the health consumer as opposed to just supporting to provider exchange, is this whole area of giving the healthcare consumer in that region a way to go in and manage their consent. Well, okay, now we get right to the crux of the problem, which is, the identity verification and the authentication. If you're going to manage consent, you need to make sure the person doing it has the right to, is the rightful person of that healthcare data and therefore need to opt in or opt out. And this becomes a bigger and bigger problem as we then get to from just opt in, opt out to more granular consent, where we have to worry about, different parts of our medical record. And again, I was at the state HIT conference, which is a lot of Medicaid organizations, but also a lot of HIEs that partner with Medicaid in their states. And this whole area of consent and granular consent was a huge topic. And then Mike, I think that's where also we tie in, and we've had Ron and I have had some conversations with Peter. Ron, for those of you who don't know, is our VP of interoperability, more of our technical resource here, working with the national networks. And we, in that whole area of EMPI and as Peter beautifully put it, de-identified unique identifier. So it's basically a unique identifier, but it's it's in essence not really tieable, to other things or to other aspects about you, as it's a token, right? So it's much more consistent with other cryptographic standards. So I think that we agree with you. We think there might be a there, and we're trying to help I think what we feel this conversation is important is not just the use case for individual access services, but the HIE use cases, the consent management, and then this whole conversation around nationwide data exchange or regional data exchange, and starting to leverage the token in more ways. And I think TEFCA is the first example of using the token as part of the message, right? That the whole implementation guide or SOP around IAS is that you have this unique token tied to the patient, and that's happening as part of the actual transaction. You mentioned CCDA, for example, but it's in the metadata of the message tied to the patient query. So, it's showing that it's possible. And I think, Lisa and Scott, you guys are working with folks that, may already have done some of this with ID.me because of the Medicare tie-in or the IRS tie-in. That's another reason why we think, we not only do we really like Peter and have found him tremendously helpful and their team overall to be tremendously supportive from an education perspective, but knowing that a sizable part of the population has already interacted with ID.me, also I think is a benefit. So I know we didn't allow much time for questions. I apologize for that. We do have a few minutes, so I'll be quiet. Anyone want to unmute and please throw something out. We can keep going a little bit longer.
Yeah, let me answer Lisa's question about thoughts on how to best shut down identities after an individual dies. So from an IAL2 perspective, we want to make sure that when we're checking authoritative sources, that's the best that we can do. So if these authoritative sources are returning a deceased value for that individual, then we're not going to go ahead and mint that credential. And then this is where in AAL2 it becomes important, right? Because you need to be able to consistently determine whether or not that individual's identity credential is still valid. So as part of our AAL2 checks, we're also ensuring that their IAL2 identity is still valid, right? So if that individual, we receive records that an individual is deceased, and we'll update our records accordingly.
And I saw Martin's comment that the Commonwealth Office of Digital Excellence in Pennsylvania is implementing an IAL2 solution. And so that the state level and then the statewide HIE is going to be able to leverage that. That's very exciting. Okay, Mike threw another question in there. It looks like it's about pricing. Sorry.
Yeah. So Mike, we think that acting on a transactional model monetizes friction. So what we do is that we operate on a per active user per year, unlimited uses. So if an individual fails, we don't charge you for that. If an individual successfully completes their verification and then doesn't use your service for the next 365 days, there's not an automatic renewal. It's only for the individuals who are active and delivered a verified identity. And as part of our services, we don't upcharge for the video proofing or anything like that. It's just one flat rate.
Yeah, I think that's a really key piece because I really do believe that that's some secret sauce right there.
Yeah, and it puts the onus on us, right? We need to be the ones that are delivering an effective solution with minimal friction. And if we fail to do that, then our investors get mad. So that's pretty much how that works.
Well, and Zen will be doing our first customer doing IAS, and they are going to be using ID.me for their identity, their IAL2 and AAL2. Starting to roll off the tongue, Peter. And so, hey, yeah, we'll let everyone know how it goes. We're super excited about that. Starting to get expanding use cases in our nationwide data exchange for our customers. And then, we feel very good about the partnership with Peter and appreciate the help. But each one of you, if you want to talk with Peter directly, we will share the slides so that you have his contact information. If you want me to facilitate something, for those of you who know me and work with me on a regular basis, I'm also happy to do that. So we are 1 minute over time. I appreciate so much everyone's participation. This is a great group, and you stuck with us. I think almost most of you stayed the entire time. So Peter, you did a great job.
Thank you. And if you reach out, make sure you tell me which Jessica Shaw you were. I won't. Yeah.
That's right. I love it. All right. Thank you so much, everyone, and have a great rest of your day. Thanks, Peter.
Thank you.
Bye.